Good afternoon, everyone. My name is Francis Masiye. I work in the Directorate of Research, Postgraduate Studies and Outreach at the Malawi University of Science and Technology in Malawi. Thank you very much for making a choice to participate in this mini symposium on research ethics. This afternoon, I'm going to talk about findings of a study on experiences of REC members and administrators in Malawi in reviewing research protocols during the COVID-19 pandemic. In this presentation, I'm going to talk about the background to the study. I'll also talk about the study objectives, the methodology that we use to conduct the study, and then I'll highlight the key findings of the study. Finally, I will make some recommendations and conclude this presentation. As a background to the study, the COVID-19 pandemic has ravaged many nations on the global level. This has caused health systems to adjust and develop stringent measures to contain the pandemic. And the research ethics committees in Malawi have not been spared by the pandemic. In response to the challenges caused by the COVID-19 pandemic, Malawian RECs developed research guidelines to guide the researchers during the pandemic. However, there is no ethical guidance that was developed for REC members who review research protocols during the COVID-19 pandemic. Therefore, we decided to conduct this study to learn the lived experiences of REC members who review research protocols during the pandemic. We developed this proposal as a response to the WHO request for proposals to support the work of the WHO Headquarters Global Health Ethics and Governance Unit in identifying and understanding ethical issues raised by the COVID-19 pandemic. The main aim of this study was to understand experiences of REC members in Malawi who review research protocols during the pandemic. Specifically, we wanted to explore Research Ethics Committee members' experiences in reviewing research protocols and to identify common ethical concerns raised by REC members during their reviews of protocols during the COVID-19 pandemic. This was a cross-sectional study. This was qualitative in nature, and the study involved in-depth interviews with REC members and REC administrators. The study was carried out in Blantyre, Lilongwe, and Cholo in Malawi. In total, we recruited 15 participants. Out of these 15 participants, we had 12 REC members and 3 REC administrators. Thematic analysis was used to analyze the data. After analyzing the data, we categorize the findings into two. The first category looks at experiences regarding REC operations during COVID-19. And the second category looks at ethical issues raised during protocol review meetings during the pandemic. I'll now start explaining the experiences regarding REC operations during COVID-19. The first issue that was raised by our participants was the development of guidance documents and standard operating procedures for REC reviews. It was reported that the country does not have research ethics guidance for REC members, and therefore members felt that we need to have a national guidance document for conducting reviews during emergencies such as the COVID-19 pandemic. It was also reported that RECs do not have specific SOPs to guide their operations during pandemics such as the COVID-19, and therefore they recommended that RECs should develop new SOPs to guide their operations during the COVID-19 pandemic. The second issue that was raised was about the challenges of fast-tracking research during COVID-19. It was noted that most RECs don't have SOPs for fast-tracking high-risk studies during pandemics. The current SOPs that RECs have are for expedited reviews of low-risk studies. However, in the context of COVID-19, there are some high-risk studies that need to be fast-tracked, and yet most RECs don't have SOPs for fast-tracking such high-risk studies. Therefore, it was actually recommended that there is need to develop SOPs for fast-tracking high-risk studies during pandemics such as the COVID-19 pandemic. The third issue that was raised was about holding face-to-face REC review meetings versus virtual meetings. Among the selected RECs, participants from one REC reported that they have been holding face-to-face meetings ever since Malawi registered the first case of COVID-19. In contrast, participants from other RECs reported that they changed their meeting procedures from face-to-face meetings to virtual meetings. The RECs that decided to conduct virtual meetings as opposed to face-to-face meetings decided to do so because they were afraid of exposing their REC members to risks of COVID-19 infection in the face-to-face meetings. Although some REC members felt that the COVID-19 prevention guidelines that were stipulated by the World Health Organization were effective in preventing COVID-19 infection. Our findings also show that members who attend virtual meetings are provided with sitting allowances only, while members who attend face-to-face meetings were receiving both sitting allowance plus other types of allowances such as accommodation and fuel refunds, among others. And the allowances appear to be a major motivator for REC reviewers. The fourth issue that was raised was about the effects of internet data costs and poor connectivity affecting virtual REC review meetings. As indicated in the previous slide, some RECs were holding virtual review meetings using Zoom or Skype. However, participants had mixed reactions to virtual meetings. Some participants reported challenges with virtual meetings, as some REC members could not attend all the virtual meetings due to high data costs and poor internet connectivity in their residential areas. While other participants reported that the virtual meetings had improved the number of members attending review meetings to the extent that they felt they need to continue virtual meetings even after the COVID-19 pandemic. It was reported that some REC secretariats were able to provide data for internet use to members, and attendance at such virtual meetings was much better compared to physical meetings before the COVID-19 pandemic. And for virtual meetings organized by the other RECs who did not provide data for internet, their meetings registered a good number of absenteeism. The fifth issue that was raised was about inadequate REC funding during emergencies. Participants reported that RECs did not have separate budget lines for emergencies such as COVID-19 when the pandemic hit the country. Due to this lack of funding and specific budget lines for COVID-19, RECs were struggling to provide adequate protection to their members, and again meeting the needs of their REC members. Some participants felt that other members may have contracted the infection during review meetings because there was inadequate protection. The participants in this study recommended that RECs and researchers must provide adequate measures for prevention of COVID-19 to their members. They also recommended that REC members should be provided with laptops for use during virtual meetings, since some of them do not have laptops. Now I'm going to highlight two ethical issues that were raised during review of research protocols during the COVID-19 pandemic. The first issue that was raised regarding the review of research protocols during the pandemic was the issue of revising financial compensation for research participants. Here in Malawi, the debate around financial compensation for research participants is an ongoing issue. However, the REC members that we interviewed wanted researchers to provide appropriate compensation during the pandemic because the public transport costs had increased. The last issue that was raised was about inadequate safety information to conduct clinical trials involving herbal medicine. It was reported that during the pandemic, some researchers submitted applications to conduct clinical trials on herbal medicines that were believed to cure or treat COVID-19. However, the RECs observed that the herbal medicines were not tested in labs nor in animals, and none had been tested in phase 1 trials. In other words, results for preclinical studies on the herbs were not available at all. The researchers provided a justification that herbalists had been using the herbs to treat patients, and observation data appeared to show that those herbs are effective in treating COVID-19. However, members of the RECs felt that it was unacceptable to conduct clinical trials without in vitro testing, while others still felt that Malawi doesn't have the capacity and has no sufficient supplies and equipment in chemical laboratories to conduct in vitro studies on herbal medicines. Therefore, those research protocols that were submitted by researchers to do clinical trials involving herbal medicines were rejected by the RECs. Based on the findings of this study, we would like to recommend the following. First of all, we would like to recommend the development of country-specific ethical frameworks for review of protocols during pandemics such as COVID-19. We would also like to recommend inclusion of specific budget lines for emergencies in REC annual budgets. Finally, we recommend that RECs need to develop appropriate preparedness measures in order to adequately perform their oversight roles during pandemics such as the COVID-19 pandemic. To conclude, I've highlighted challenges of REC operations and those encountered by REC members during protocol reviews. And these challenges include inadequate REC guidance, fast-tracking of high-risk protocols, lack of funding for dealing with emergencies by RECs, effects of high data costs and poor internet connectivity for virtual meetings, and lack of capacity to conduct in vitro, in vivo, and phase 1 studies on herbal medicine. Finally, I would like to thank the WHO through the Global Health Ethics and Governance Unit for funding this study. I would also like to thank all study participants from the 3 RECs that took part in this study in Blantyre, Cholo, and Lilongwe. I also thank you all for your attention. Thank you.